Hello and namaste. I am Dr. Kshitij vitreoretina surgeon and ophthalmologist, your ophthalmology faculty at Medicoz community. So basically now what we are going to discuss is NEET PG 2023 recall questions. These questions are framed based upon the recall made by students. So any additions or any subtractions in the questions, in the framing of questions, you can report to us, you can write to us, or you can visit our Instagram or Facebook page and let us know. You can also visit our website at www.medicoscommunity.com. So basically, NEET PG 2023, I would say for ophthalmology was at a moderate level. There were hardly 20 to 30% questions which were not, I would not say difficult, I would say they were a little bit tricky based upon concepts only. So all these questions were basically on the high yield concepts. All the concepts were very important, which are very frequently asked, and some of them were application based, 2 or 3 questions out of 10 questions, I would say. So if you've seen my previous video also, which was regarding the high yield concepts in ophthalmology, which were 25 most important clinical MCQs, also from that video also some of the concepts were there in the exam. So make this very sure in your mind that the NEET PG exam or the PG exam now, the entrance exam is going to be on the clinical concepts and all the concepts which are very important concepts. So you need to be very clear and thorough with the concepts. That means you can apply those and you can also answer the questions which are slightly tricky or where the options are slightly twisted. So let's move on then. Okay, so let us start with NEET PG 2023 recall. So there were 10 questions in ophthalmology totally, and if we see the topics, these were all from very standard topics and important topics. So basically the first question was on congenital glaucoma, the other question was on cherry red spot, metabolic disease. So cherry red spot, metabolic disease, vein occlusions, artery occlusions, there is always one question on this topic, so you should definitely do this topic very well. So one question was on conjunctiva, cornea, cataract. These are very common topics. Optic pathway, there was one question. Refraction, there was one question asked. Colors in ophthalmology, we can take an entire class on colors in ophthalmology. So there was one question asked on that. Sturm's conoid, there was one question. This is a very crucial topic, Sturm's conoid. Lid and extraocular appendages, there was one question asked. So these are all very standard and very crucial topics and common topics also, not very out of the way. So you should be very well versed with your optic pathway also. Okay, so let's move on to the first question. So let us read this question. What are they asking? An infant having difficulty in opening the eye presents to you with cloudy cornea and watering from the eye since birth. What is the most probable diagnosis looking at the picture given? Okay, so don't confuse with a uniocular or a binocular cloudy cornea. First of all, that is what I want to tell you here first. The answer is congenital glaucoma for both of them. Okay, so if this was the picture given or this was the picture given, we don't know what was the actual picture given, or it wasn't the same picture given, obviously we can understand. But even if it was one eye involved or other eye, both eyes involved, the answer would be congenital glaucoma. Okay, so what do we know about congenital glaucoma? The triad is consisting of epiphora, blepharospasm and photophobia. So just to rule out the other options, it can never be congenital cataract because it will not look like this and the features given are cloudy cornea and watering. So congenital cataract is ruled out. Ophthalmia neonatorum has classic discharge. I will show you the photo of the baby. And mucosacchalar polysaccharidosis is completely different term. It cannot be mixed with all this. So see this. This is ophthalmia neonatorum having classic discharge here. Baby with ophthalmia neonatorum, and this is congenital cataract. Okay. So I guess the answer to first question is very clear, and the first question was easy to answer also. Okay. So we move on to the next question. A 4-year-old child having cherry red spot on the macula. Associated features given are mental retardation and skeletal muscle weakness. So what is the diagnosis here? Okay, so this cannot be cataract, this cannot be glaucoma. So we are going towards cherry red spot. What are the differential diagnosis in the cherry red spot? Yes, what do we know? This is the mnemonic that we know. Cherry trees never grow tall. So C stands for CRAO, T stands for Tay-Sachs disease, N stands for Niemann's Peak disease, G stands for Gaucher's disease or GM1 gangliosidosis, and T stands for trauma, or it can be called as Berlin's edema. So out of these in our mnemonic, which are we considering here? These are all metabolic diseases given. So the answer here is Tay-Sachs disease. Okay. So what are they saying? More than cherry red spot, they have given mental retardation and skeletal muscle weakness as associations. They have not mentioned about any hepatomegaly. So there is no hepatomegaly in Tay-Sachs disease that we know. We are not very sure about the options. You people can comment and tell us what were the clear options. Was there Gaucher's disease in the options, or there was Krabbe's disease? Many students have mentioned that there was Gaucher's disease. Anyways, the answer will remain Tay-Sachs disease in spite of whatever the option was given. So you can update us in the comment box, or you can visit our page and give us what was the exact option given here. So not to go in details about the explanation in this question, but we know that the Tay-Sachs disease is caused because of the deficiency of hexosaminidase A enzyme. Niemann's Peak disease is caused by deficiency of sphingomyelinase, and Gaucher's disease is caused because of the deficiency of glucocerebrosidase enzyme. So this is the sphingolipid breakdown and the pathway which you must know while studying. So coming back to the question, I just want to revise that this was a 4-year-old child having mental retardation and skeletal muscle weakness and having cherry red spot. The answer is Tay-Sachs disease. Also, we had this is the past video, the picture from my past video, where we had discussed the cherry red spot, where the question was framed on CRAO. So what I want to stress here is that cherry red spot, artery occlusions and vein occlusions is one topic where you need to be absolutely clear, and it's repeated. Okay. So this was an image based question given, and we are not sure about the image, but if it was a limbal dermoid image like this, then your answer would be B, limbal dermoid. But if it was a similar lesion given, but it was not encroaching the cornea, it was away here or here at the limb, away from the cornea, so this would have been the answer, lipodermoid. Okay. If it was limbal dermoid, then what facts you should know about the limbal dermoid is golden hair syndrome is one question that you can be asked about in the figure which is given as limbal dermoid. This is characterized by classical triad like mandibular hypoplasia resulting in facial asymmetry, ocular and auricular malformations, and vertebral anomalies. So this is the classical picture which we see in golden hair syndrome about the limbal dermoid. If it is not limbal dermoid, then the other picture you can type us in the comment section if it was lipodermoid, if it was not encroaching on the cornea. Regarding the other options, pingecula is very benign and it never encroaches cornea or limbus. Pterygium is an inflammatory mass and it appears red and it always encroaches the cornea, but nothing like this figure. So pterygium and pingecula are not even closer to these figures, but limbal dermoid and lipodermoid could have been the answer depending on what the exact diagram was given. So you know that now that if it is limbal dermoid, if it is near the limbus, if it is not near the limbus but similar elevated structure is given, then it would be the lipodermoid. Okay, am I clear? Can we move to the fourth question? Okay, let us see what the fourth question is. A 65-year-old diabetic female. Okay, now this is the term that they have used to confuse you in the question. With painless loss of vision over 2 to 3 years with colored halos. On the basis of ocular examinations and the findings shown in the figure, discuss the diagnosis and management. See, they are asking not only the diagnosis, but they are asking management. So your answer becomes a bit more easy because you know that this history, which is suggestive of painless loss of vision over 2 to 3 years with colored halos, is definitely suggestive of cataract. But what they have said here is old diabetic female. Just to confuse you, they have given in the options sunflower cataract, but the treatment that they have given is diabetic control. So this definitely is not the answer. Any cataract now is treated with phacoemulsification and IOL surgery unless and until any other surgery like ECC or SICS is required. So rosette cataract is traumatic cataract. So the first option is ruled out and ECC is the treatment that they have given for it. Second option is immature senile cataract. If you see this figure, there was a similar type of figure given, I know, and it was many of the students have reported similar figure. So it was immature senile cataract and the treatment for it is phacoemulsification and IOL. So we come to the conclusion that this was the answer. Zonular cataract and lensectomy again is a very different diagnosis and not going with all the things that they have mentioned in the question. So one more thing I want to stress here is the differential diagnosis of colored halos is what you should keep in the mind, because we have discussed a similar kind of question before and it was based on the first kind of differential diagnosis. The differential diagnosis for colored halos is acute mucopurulent conjunctivitis, acute angle closure glaucoma and immature cataract. See, this was the previous question that we had discussed in the last kind of my video. So now they have asked a question on immature cataract here. This is just to show you some figures. If you see, this is zonular cataract, okay. This is lamellar cataract, okay. This is rosette cataract and this is your diabetic cataract, that is snowflake cataract, okay. So don't confuse it with the immature senile cataract, which was the classical thing given in the question. Again, just seeing the question, your management is always phacoemulsification surgery with IOL. Okay, are we clear? So we move on to the next question. Question number 5. Point out the likely vision. Now this was not an image based question, it is what the students have reported, but they have mentioned that point out the likely lesion in the visual field pathway. Patient has space occupying lesion and is on some treatment. So now we are not clear as if what some people have recalled that there was loss of vision on the left side, or there was binasal visual field loss given, or some people are saying there was right visual field affected, or there was binasal hemianopia or bitemporal hemianopia. Anyways, so what I am trying to tell you here is, considering that there was left, many of the students have given us that there was left nasal field loss. So if you see correctly at this figure, if there was a left nasal, that means here field loss, that means the right sided optic tract is affected. So if we come back to the question, the answer will be right optic tract. Okay. So be very well versed with your optic pathway. This was the question we had discussed in last video also, and we had discussed the entire optic pathway also that time and the lesions associated with it. Be very thorough with all these lesions, pie in the floor, pie in the sky, and the contralateral and bitemporal hemianopia and all these things. So when we are discussing about the left nasal hemianopia, that means left field loss, then that means the right optic tract is affected very clearly. So answer becomes simple. If you are very well versed with the optic tract and the visual pathway, you will never commit a mistake in that. This is one question where you will get complete marks based on what you have visualized it as a concept. Okay, so moving on to the next question. Here they are saying that there is an elderly patient with decreasing far vision but does not need glasses anymore for near vision. Which cataract or which refractive error was asked in the question? Am I right? Just put your comment in the box. Whether they had asked which kind of cataract is it, or whether they had asked which kind of refractive error it is. So anyways, the answer is upon the concept and we'll discuss that. Elderly patient with decreasing far vision, okay, suggestive of some cataract changes, but does not need glasses anymore for near vision. Which cataract is this? Okay, now see this ray diagram very clearly. What happens is, this is the near object, this is patient's eye. Now in a presbyopic eye, where the patient has poor accommodation and reduced elasticity, the image is formed behind the retina. Okay, and because of that it is blurred, so you need to correct it with the presbyopic glasses. But what happens here, when a patient develops cataract or a patient develops nuclear sclerosis specifically, there is higher refractive index of the lens. Because of this, the light rays converge more. Okay, while they were diverging here and forming an image behind the retina, now they are converging more and image forms very clear at the retina. Okay, so this is what is called as the effect because of nuclear sclerosis cataract. And here there is index myopia, okay, or nuclear sclerosis. Okay, so this is the clear-cut answer, because the changes are in the refractive index of the lens because of the cataractus, that is nuclear sclerosis changes. Okay, very clear. So we move on to the next question, which is 7th question. So they had given this figure to you and they had said identify the stain as shown in the figure. Now what they have mentioned in the option is fluorescent dye with cobalt filter. So this is a image of a dendritic corneal ulcer which is stained with a fluorescent dye and seen with a blue filter, that is cobalt filter. So yes, our answer is fluorescent dye with cobalt filter. Do not confuse it with Lissamine green. Lissamine green looks very different. I will show you the figure next. Again, all the other options are also not very valid here. Rose Bengal dye is not the answer here. Just to summarize the vital stains here again in the ophthalmology, sodium fluorescent is yellow in color and it stains corneal tissue, used most commonly for corneal tissue. Rose Bengal stain is red in color and it stains the conjunctiva. It's used mainly for conjunctiva. Lissamine green is green in color and it again stains the conjunctiva. Okay. Sodium fluorescent is used in the cobalt light. Rose Bengal is used in the white light and Lissamine green is used in the white light again. Just to tell you now that we are discussing about the stains, so trypan and dyes. So trypan blue dye is very important in ophthalmology. It's used for the anterior capsular staining in the SICS surgery or the cataract surgery. Also in other types of cataract surgery also it can be used. It provides you higher success rate of capsular access completion without capsular tears, and it is FDA approved for ophthalmic use. So this we know about the dyes and the stains. Just to show you the figure, this is Rose Bengal, this is Lissamine green, and this is our fluorescent with cobalt filter. Okay, this was the question given. Also to show you some other corneal pathologies, this is how the corneal abrasion looks when stained with sodium fluorescent. This is the corneal ulcer, this is herpes conjunctivitis, okay, and corneal laceration. We'll be dealing with this in the detail in the class. So this was the 8th question. Now this was tricky because now they have not provided a figure to you, but they are asking you about the investigation with giving some hint about what you can visualize. There is a brown ring around iris. What is your investigation of choice? We know brown ring around the iris is definitely Kayser-Fleischer ring, that is KF ring. Okay, and this is a very common topic to ask. So this is KF ring, brown ring around the iris, and what they are asking is investigation of choice. We know that KF ring is because of the copper deposition in the desmet of the cornea. So this is serum ceruloplasmin. The investigation of choice is obviously serum ceruloplasmin. So this was a pretty easy question, I think, to answer, and one of the easiest, I think, out of the 10. Okay, coming to the next question, question number 9. They are mentioning a diagram given here and they are asking which refractive error is shown in the diagram. So which is this diagram? Yes, you very well know that this is Sturm's conoid, and Sturm's conoid is used only for astigmatism. So cannot be hypermetropia, it cannot be myopia, low vision is nothing, nowhere related. Okay, so what is Sturm's conoid? It is a configuration of rays refracted to a toric surface. Okay, the conoid of Sturm happens when there is astigmatism present in the eye. What are its main elements? Its main elements are two focal lines that are created by two meridians of the toric lenses, and the distance between two focal lines is called as the interval of Sturm, focal interval of the Sturm. How is it? One more question that can be asked on the Sturm's conoid is, how is it corrected? It is corrected with a spirocylinder lens in such a way that circle of least confusion is placed on the retina, making the image more clearer. Understand this. We'll go to Sturm's conoid. See this. What we were saying is, this is the spirocylinder lens. These are two focal lines. Okay. This is the focal interval of Sturm. This is the circle of least confusion. This is the Sturm's conoid form because of the two focal lines. Okay. What is used to correct it is the spirocylinder lens, where your image will form on the circle of least confusion. Okay. So we are clear with this. They are asking what refractive error, and it is obviously astigmatism, because it happens when there is astigmatism present in the eye. Okay, coming to the last question, question number 10. There is some discrepancy about the figure, but many of the students are saying that figure was like this. Okay, if this was the figure, then the answer is glaucoma. If this was the figure, then also the answer is glaucoma. So answer doesn't change because of the figure. Let us read the question first. The child came with dark colored expanding lesion on one side of the face. Okay, what we know is the child has a lesion on one side of the face. Okay, one side of the face, and it is a dark colored lesion. What is the most likely complication to look for in his life? So both of these, either a nevus of Ota or melanocytic nevus, both of these are not going to malignant transformation, because these are benign lesions and very rarely they go into malignant transformation. So the answer is glaucoma. Both of these can go into glaucoma. There is no relation with cataract, no relation with loss of vision, so other options are very easily ruled out. So just see if which was the figure given here, if it was melanocytic nevus or nevus of Ota, but both of these do not go easily to malignant transformation. The answer is definitely glaucoma. The patient will have most likely complication to look for in his life is glaucoma. Okay, so we have come to the end of all 10 questions. So I expect that you must have written it very properly. You must have answered all the questions. Not very difficult. It was, as I said, some questions were easy and some questions were moderate, and very easy to answer if your concepts were very, very clear. So remember, your concepts need to be clear and you can apply them, and just think about what you know about them. Okay. So thank you so much.